Good morning, and thank you for joining the Downtown San Diego Partnership for this discussion on the economic impact of COVID-19 and plans to reopen the region. I'm Betsy Brennan, President and CEO of the Downtown San Diego Partnership and the moderator for today's discussion. A couple of housekeeping notes for the format of today's webinar. We have received the questions you submitted during registration and we'll try to address as many of them as time allows. If questions arise during the webinar, please submit them through the Zoom question and answer function. Mayor Faulconer will take questions immediately after his update, and the rest of the Q&A will begin after we have had an opportunity to hear from our speakers. CEO Crespo from the Mayor's office will also be listening in on the remainder of the conversation to take down any additional questions for the City of San Diego. So let's get started. As the principal voice and advocate for the 275 blocks of downtown residents and businesses, including more than 350 members and 11,000 property owners, we know there is tremendous need in our community in response to the COVID-19 crisis. What we've learned from you and through my participation in the Recovery Advisory Group formed by City of San Diego Mayor Kevin Faulconer and County Supervisor Greg Cox is that the impacts of COVID-19 have been felt in almost all corners of the regional economy. From retail to entertainment and manufacturing, industries across the spectrum are doing their best to weather the current storm of uncertainty. As many of you plan for a future where current restrictions begin the process of safely loosening, we know questions remain about what that process will look like and how different industries will have to adapt data, how plans are being formulated to reopen the region, and how different industries can prepare for the next phase of recovery. We hope to begin to provide some clarity on what this next chapter will look like for the San Diego region. Our discussion today will cover what we know thus far, but we encourage you to get in touch with us as this transition continues to communicate the needs of your industry to reopen safely. We know those needs are as unique as your businesses and want to advocate on your behalf. In this effort, we have been fortunate to have the quick and dedicated collaboration of our elected leaders, one of whom is going to be joining us today. Earlier this week, Mayor Faulconer and County Supervisor and Board Chairman Greg Cox introduced guidelines developed by industry and workforce leaders to prepare the region to restart our economic activity. I just got a message that Mayor Faulconer is running just a little bit late, so we're going to jump with our proposal. Mayor Faulconer is in another really important meeting and will join us in just a few moments. So we're going to jump to one of our other panelists. He'll give his presentation. Then the mayor will come back on, give his presentation, answer questions and answers, and then we'll go back to the other panelist, and then both panelists will answer questions at the end of the panel, just to confuse you a little bit. So I would now like to welcome Craig Benedetto. Craig is a partner at California Strategies and the past chair of the Downtown San Diego Partnership. He serves on the San Diego Resiliency and Reopening Alliance, an informal group made up of partnership of some of our member agencies such as BOMA, NAOP, Chamber, and many others to highlight the needs of workforces returning safely to work. They have been providing valuable input and information for the Recover Advisory Group. With that, I'd like to introduce Craig Benedetto.
Morning, thank you. Appreciate this, Betsy. And hello, everybody. I think Taylor is going to be putting up a presentation onto the screen. So if we can do that, thank you. And if you can just go to the next slide, I'm going to talk a little bit about reopening and at the back end, a little bit about advocacy in the time of COVID. As you know, the federal government through the president announced a couple of weeks ago a phased approach to opening. It included some gating criteria. And obviously this was the start because as you have from the top level, the federal government, it comes down to the state level and then the state level down to the county level with the public health officials and the board of supervisors determining what to do next. Typically what we've heard in all of these discussions is it can't be any less than what is being required at each of these levels of government, but it could be more. So federal will step probably minimum standard, state something more than that, and then the locals could do more than that or just be consistent with the state. Flip to the next slide, please, Taylor. You can see here that the guideline for all phases, at least from the federal government as it relates to employers, includes a number of things. Obviously, social distancing is going to continue to be key as is testing, isolation, and contact tracing. And this is becoming a theme in terms of what phases we move to next. Sanitation, use and disinfection of common areas, that's all very important. Facial covering has been important in San Diego as well. If you flip to the next slide, please, Taylor. We have 3 phases at the federal level. Telework is going to continue, I think, for some time to come. But phase 2, if we get to that, some schools can reopen. And then, of course, in phase 3, we get to a much broader set of reopening with lesser standard in terms of physical distancing and those kinds of things. Let's go to the state next, since this is probably more relevant for California. One of the key metrics that's been talked about is a stabilization of hospitalization. Obviously, use of our ICUs becomes really important, and it's basically what we now know it as is flattening the curve. California has recorded its first week-over-week reduction in COVID-related deaths. Betsy, I see the mayor there, and I know he doesn't want to hear what I have to say, so I'm hoping that, and I want to hear what he has to say, so maybe we can pause here and go to him.
I always want to hear what you have to say, Craig. Thank you, my friend. Good morning, everybody. I'm off mute, I believe. Craig, Betsy, everybody, thank you for joining us. It is on the group. Let me just jump on in. I know the focus is on reopening, and I'm happy to give a brief update, then maybe a couple of questions, however you want to run it. But obviously a lot of work countywide, and that's one of the things that I've been really stressing is that when we come up with recommendations, that we do it by the region, so we don't have different rules for different cities. I'll just give you a good quick example. The work that we did in San Diego on our beach reopenings, it was all beach cities. It was the lifeguards. It was working with our county public health officials. That was a model and a template that is being now followed in other places across the state that San Diego was leading. We're doing the same thing when it comes to reopening businesses. And so the recovery group and the associations, of which the partnership obviously played a big part in this, over 30, North County, East County, all across, South County, all across our region, really with one goal: how to make sure that we are ready as a region to safely reopen businesses once we have the modifications from the governor's stay-at-home order. And so, as I think probably many of you know on the call today, the recovery group forwarded that to the County Board of Supervisors, and the Board of Supervisors unanimously moved forward with a framework earlier this week to safely reopen, both some general guidelines, and we put forward some of the group, some specific guidelines, for example, like restaurants, some of the precautions that we will need to take. The developments of the recommendations of the group, again, were also done with our county public health officials who participated in that. So I believe it's incredibly important that we do things safely, we do things clearly and consistently, and that we're prepared. And so we're likely to hear some modifications of the stay-at-home order a little bit later on this morning from the governor's office. I believe that will also entail allowing the flexibility of certain counties to perhaps move faster or slower. That remains to be seen. But from an overall perspective, what we've really tried to set the tone here in San Diego is that we will be ready with that overriding goal. We must protect both the customers coming into businesses that reopen and also the employees. And the folks that developed all of these recommendations were our business owners, and the folks that are right there on the front lines. And so I think we're going to get a little bit more information, as I said, a little bit later this morning out of Sacramento. We will be ready to adapt and move quickly and to move safely. So let me go ahead and pause, and Betsy or Craig, however you want to take it from me.
All right, great, Mr. Mayor. Thank you for joining us. We're going to go ahead and take just a few questions for you because we know you are very time pressed, and we appreciate you joining us and the more than 300 people that are on here this morning. Very interested in this topic, of course. The first question, Dawn asks, will the homeless be allowed to remain on the streets in downtown San Diego in close clusters in your businesses, or will you encourage them to go to the convention center or other resources?
The convention center is, I'm actually going to leave this Zoom meeting here in a few minutes and be at the convention center. It's an incredible resource that is working to get folks off the street and to help stop the spread of the virus among one of the most vulnerable populations that we have, which is our homeless population. As I think, we moved our bridge shelters, all of those operations into the convention center to achieve the social distancing that you could not get in the bridge shelters. And so we have all of our providers, Alpha Project, Father Joe's Villages, and Veterans Villages, all there, all operating safely. Everybody there getting tested. And it's been a remarkable effort, all hands on deck. But I think to the question, the goal is to make sure that we have the institutions in place, if you were all there at the convention center, which is why I'm going over there a little bit, to make sure that we use this as an opportunity to place people into that apartment of their own, to get those permanent supportive services, that wraparound services, and to move quickly and expeditiously to that. So there is a all hands on deck effort that is happening down at the convention center between the Housing Commission, the Regional Task Force of the Homeless, the County of San Diego, representatives from the VA there, to really, as I said, seize this moment on all of the individuals that are in one place to cut through some of the bureaucracies and to move forward, as I said, with housing opportunities to move quicker than a lot of other cities ever dreamed of doing. And so the work that we've been doing on trying to eliminate some regulations and red tape back in Washington with HUD and the VA, I think we're going to bear fruit here in the next coming weeks. A real opportunity, particularly on the veterans front. And so our goal remains to be a leader in San Diego. As I think those of you that are on the phone may have seen, or the video, I should say, last week, the partnership has been a leader on solutions for homelessness. And the fact that we reduced our countywide again by 6%, I think shows San Diego's leadership, while you've seen other places that are still unfortunately increasing. So when we look at programs that work, particularly family reunification that was started by the partnership, that has been expanded by us here in the city at the partnership, all of those efforts are working. We're going to see that continued reduction. And as I said, we have a real opportunity now, particularly with some of the CARES dollars and others, to expand our capacity, which is what we were looking at doing in terms of permanent hotels, lease to own, other options, to get people off the street for good into that place of their own and have a sustainable funding source. So the convention center has been a real beacon of hope, but it's temporary, right? Once we get through this crisis, we need to get that convention center up and running. We need to get conventions back, get our economy going. But it's been a real opportunity for us, as I said, to keep people safe in the short term, and really to use that opportunity for the long term to get everybody in one place and to cut through a lot of the bureaucracy. And I will just tell you a long answer to your question, but there's a lot going on there. I love to see the spirit and the momentum of all of the folks that are down there, all of the different agencies and others that are in the same place. I think you're going to see some incredibly positive results.
Thank you, Mr. Mayor. We have quite a few questions, including from Alessandra, Ashley, and Carol, about childcare providers in schools and their ability to reopen, as many people would like to get back to work and would like to understand the best practices and safety for children, staff, parents, and guardians, and are there plans in place for schools and childcare facilities in San Diego?
Let me just say, I agree with the premise of the question. Childcare is absolutely essential when we talk about reopening the economy. Childcare is economic development. And schools are a big part of this. One of the reasons why Superintendent Cindy Martin joined the Recovery Task Force, to make sure that we are working very closely with our school district and that we will be advocating for the funding that they need to safely reopen at the level that our local San Diego schools need to reopen. In the meantime, we're looking at using some of our dollars that we received from the federal government to bolster childcare opportunities, particularly for our first responders and some others, and to expand that into larger categories. Because we need to, because it's absolutely essential that as we begin to open back up, that the issue of childcare and the issue of education and the schools go hand to hand. This is an area where we are united with the city and with the county in terms of some of the dollars that we've recently received from the federal government. And so as we are putting these steps in place to reopen, that will be front and center to open those opportunities as well.
Thank you very much for that. And we know you're very busy and you have another meeting to get to. So this will be our last question for you today, but CEO Crespo from your office is going to stay on the phone and take down notes and get us many answers to the questions we're not able to get to for the mayor today. So the last questions from Sandra and Christelle had a similar question. A lot of businesses that aren't slated to open until later phases of the state's plans are really hurting. How can these customer-facing businesses, many of them small mom and pop shops, still be able to operate safely? And if they can do so sooner, may they do so?
Yeah, great question. And I think two parts to that question in terms of an answer. I know a lot of businesses are already doing the planning that would say, how would it look like if we're allowed and when we're allowed to do a phased opening, a limited reopening? So all of those issues in terms of social distancing inside your establishment, safety precautions in terms of masks, gloves, et cetera. And you can go to both on the city's website and the county's for the recommendations that we put forward on how we achieve some of those recommendations for businesses. But in terms of the when, that's an important question. And one of the reasons why we put so much time into the Economic Recovery Task Force is if we take the precautions that a business is safe to open, and we're going to follow all of the right rules, I want us to be ready to do that. And I want San Diego County to have the flexibility because I think we're ahead of a lot of other areas in making the planning that we've done to safely reopen. And so that is one of the things that you will hear. You know, like I said, we're going to get some of the information out of Sacramento a little bit later on this afternoon. But I will take the position that if we've done the necessary steps to keep businesses safe, then we should be able to move more expeditiously because of those precautions. I think it's in the best interest, obviously, for our business community. It's in the best interest of customers to make sure that we've done all of the planning, we've done a lot of it, and to allow us to have the flexibility to open safely according to those parameters, and not a parameter that says it needs to be a month or two away just because. And so that's why we've been putting a whole bunch of time on all of these precautions that will say, we know how to do it. We've taken it seriously in San Diego. San Diegans have worked very hard to flatten the curve. We will not give back those gains that we've made. And we want to take that seriousness to how we open our businesses and all of the plans and preparations that we've made to do so in a safe manner. And so that will be one of the issues that you will hear me be talking about a lot, I predict, next week in terms of our ability to expeditiously open businesses with safe operating procedures.
Thank you very much, Mayor Faulconer, for your leadership and everything you've been doing for the city and your collaboration with the county. We very much appreciate it, and we look forward to—
Thank you, Betsy. And thank you, everybody on the partnership. Thank you very much.
Thank you very much. We're now going to head back to Craig Benedetto. As you recall, he is a partner with California Strategies, and he's going to continue his presentation. Then we'll go to Ray Major.
Muted. We're lucky to have the mayor, lucky to have him on this call. So thank you for setting that up, Betsy and team. We're lucky to have him as our mayor. We really are. So anyway, I'm going to go back to the presentation. It's back up on your screen. The capacity has to be met in order for us to move forward. That's the message that the governor sent late last week as he announced the move into a phase 2 reopening for the state of California. The mayor did cover some of what's going to happen. We're going to get more detail at noon today from the governor when he does his press briefing, and then the county later after that and the city later after that will obviously have their reactions and responses to it. But the goals that the state has outlined are largely being met. in that hospitalization rates are stable, PPE inventory is improving, and the surge capacity is present in our ICUs. There's going to need to be more work done in this area. And one of the things that comes up a lot when I talk to people is, when can we move to later stages of phase 2 or phase 3? And it's going to be about testing and contact tracing. And so that's going to come with staff. The county is hiring staff. They're looking to hire up to 500 people. The state announced through one of the governor's press conferences, they're looking to hire 10,000 people, but basically to immediately respond to and put out hotspots when they arise. Because as we reopen, obviously people start getting back together. You could see a uptick in the number of cases, and they want to make sure and keep that tamped down so that we can continue to reopen the economy. Go to the next slide, please. So here you can see the 4 stages that the governor announced. Tomorrow is the 8th, and that's when we're going to start phase 2. It's going to be gradual and limited. This is not going to be offices opening up. It's going to be limited retail and manufacturing where curbside delivery can be provided. There's still going to be telework in this phase. Both offices and other businesses can open up in later stages of stage 2, but we have not hit the metrics yet, according to the governor's office, to get to that point. Part of what the mayor just said is that the counties can provide their own plans to the state and have those plans certified. And we're going to get more detail on that today from the governor, more than likely, where the counties can then either move forward faster or in some cases slower if it's not acceptable what's happening in those counties. But for all intents and purposes in San Diego County, we appear to be doing well, very well, as the mayor noted. Let's go to the next slide, please. As Greg Cox, our chairman of the Board of Supervisors, said earlier this week, the state decides the when and the local government decides the how. And so the mayor noted, go to the next slide, please, that there are things that we're doing. Locally, you leave your place, you cover your face, big, massive campaign. Next slide, please. The mayor also noted that beaches are open, but it's different. You're not able to go and sit on a blanket and hang out. You can move, you can run, you can surf, you can do your things, but it's different. Next slide, please. You can even golf. I mean, there are lots of recreational activities you can undertake, and I only focus on this in part because I'm a golfer, but it's going to be different. You don't necessarily have to wear masks on the golf course unless you're within 6 feet of people, but there are no rakes in the traps. There are things in the bottom of the pins so that you don't have to reach down and get your ball. Only 1 person per golf cart is going to be allowed. So there are a lot of things that are going to change as we move forward to, again, keep that social distancing in place and help prevent a real big uptick in the number of cases reported in San Diego. Move to the next slide, please. The mayor talked about the Recover Task Force, and Betsy touched on this before. This is a partnership with a lot of different business organizations. It's got geographic representation, a diversity of interests there. And basically, it's intended to provide guidance to the city, to the mayor, to the council, as well as to the county board of supervisors on how business should reopen. Go to the next slide, please. The task force came out, as the mayor noted earlier this week, with the plan. This is a good plan. There was a lot of input given, a lot of things considered. It focuses on 5 areas: employee safety, customer safety, workplace distancing and conditions, employee training and compliance, as well as enhanced cleaning and sanitation. Obviously, these things are all going to be very important as we start reopening. In some cases, there's going to be some changes in how this might look based upon what the governor says today and based upon what our public health officials say. And I'll note this, that just because we, in representing a business organization, want it to go one way, it doesn't necessarily mean that the public health officials will agree. And obviously this is a public health situation, so to a large extent, that's the way things are going to be handled. Go to the next slide, please. So some of those guidelines, obviously businesses are going to have to respond. They're going to have to create their own safe reopening plan that has to be submitted to the county. It's going to cover employee health. The basic rule of thumb is whether you're an employee or a customer or visitor of any workspace, if you're sick, don't go, stay home. There is the potential for enhanced health screening. You're seeing this in other countries and in other states around the country where they're doing temperature checks, for example, at the entrance to businesses. That appears to be one of the things that is going to potentially be required, but we are working with the Recover Task Force to talk about how that looks, the protocols for it, and to a certain extent, how to address liability and other issues, privacy issues that come up as a result of doing this. Physical distancing is going to be really important. How you get people in and out of buildings, how you clean those buildings. In a large office building like we have many of in downtown San Diego, if you have temperature checks required or occupancy limits in elevators, it can affect how quickly a building can get reoccupied. We're not there yet, so we have some time to think through this, but we hope to be there sooner than later. And so we're going to need to think through it, because we don't want big queues outside of buildings. We don't want, in one report that I read, a 5-hour time frame for people to be able to get into their tenant spaces to go to work. That just won't be workable. So what you're likely to see in most cases, that there's going to be a fair amount of telework, if not a large amount of telework going forward for the foreseeable future. Next slide, please. We've been talking a lot about the challenges. I mentioned a few just a moment ago, the liability of testing, reporting, and tracing, and who ends up conducting that. Is it an employer or is it a government person that ends up doing that? We're talking that through. Supply chains are a real problem. PPEs are hard to source. These personal protective equipment devices, be they masks or other things, are really hard to find. Most of them are being diverted, if they're at a medical grade, to our medical service providers, which is totally appropriate. But if there are requirements for businesses to have these on hand for their employees, for their customers, et cetera, it's going to make it hard for them to open if those aren't available. Thermal sensors, the thermometers, are going to be a problem. Those are hard to source and are very expensive if you can find them. Sanitation supplies are also very much in short supply, whether it's cleaning solutions or disinfectant wipes or hand sanitizer. They're very hard to find, and we need to have those available. But there are other means. Remember, washing your hands is the best way to protect yourself. That's what the public health officials are saying. And so using restrooms will still work, and we should look at that. Staffing and how that's handled is a real cost for business, and so we need to think about that. And certainly staggering work hours can help with some of the things I mentioned before, like queues and occupancy in elevators and things like that. But how that works on a business by business basis is going to be really important. So that's why those reopening plans are critical for each business. Next slide, please. Timing. I'm not the great Karnak. I don't know what the timing is going to be. We're presently in phase 1. The governor's going to announce a slow reopening of phase 2 today, starting tomorrow. We're hoping that there's some guidance, as the mayor noted, for allowing the county of San Diego to move forward, perhaps in a more expeditious but safe way. So hopefully we will know in the next few days what that might look like. But large gatherings, full occupancy, that's probably not likely for some period of time. Next slide, please. So for me, I do professional advocacy for a living. It's different. I don't get to go to the hearings anymore, nor does the public. The pictures I put on the screen, you're not going to see that anymore. Most councils, the Board of Supervisors, are working remotely, or they're using social distancing and how they sit next to each other. The public's not allowed to go to the hearings. Testimony, in some cases, is taken on the phone, sometimes by video, sometimes it's e-comment that's read in the record, and sometimes it's just comments that are noted that they've been read into the record and the public officials have them. You have no way to confirm that, but that's what's happening. How you end up dealing with in-person meetings with decision makers, some of them are more available now than they have been in the past, but you're going to have to get to them. You can't have a meeting in their office. You can't schedule that. You can maybe use Zoom or some other video-based device to connect with them, but it's very different, and it's likely to continue for some time. Next slide, please. Which, for the partnership and some of the organizations I work with, coalition becomes really important. Betsy touched on this earlier. It was a central point of the Recovery Task Force as well. I just put up some of the organizations that we typically work with. Consistent communications, being in alignment on those positions are going to be really critical. Working together, information sharing, that is what we're doing. We're doing it on a very regular basis to make sure that the needs and interests of business are being communicated back to the decision makers. Obviously, all of this has to be done in a safe manner and for the public safety and the public health and welfare of the employees and of the visitors, customers that come onto the job site. But we are providing that input. And like I said, the government is taking them, the mayor is listening, as are others, County Board of Supervisors, and we really appreciate their dedication. So in summary, next slide, please. I'll say this, stay-at-home orders are still in effect. There are obviously going to be some slight modifications, but still a strong encouragement to stay at home. to the maximum extent possible. Schools are obviously closed. That's going to create some challenges, and that was one of the questions that was asked earlier. Social distancing is still going to be the norm. Facial coverings will be the norm for some time to come. There will be lots of new requirements for businesses that we will probably get more detail on today and tomorrow as the governor presents his plan. And then obviously, like I said, coalitions and consistent on-time advocacy is the key for you or anybody else in terms of how these things are addressed. So I'll stop there and we can go to Ray, and then we can take questions as the partnership staff would like. So thank you for this time.
Thank you very much, Craig. Really appreciate it, and looking forward to the questions session as well. I'd now like to introduce Ray Major. Ray is the Chief Data and Analytics Officer and the Chief Economist for the San Diego Association of Governments, and he's here to tell us about some of the most recent economic data collected by SANDAG and what it can tell us about the regional impact from COVID. Take it away, Ray.
Thank you very much. Thank you for having me. Boy, is this a different story than the last time I talked to your group just a few months ago. With that, I'd like to bring up the slideshow, if we could do that. Thank you. And next slide. I'd like to share just some data with you that we've been collecting at SANDAG. And I'm just try to explain this to you at a very high level. So the numbers aren't as important as the trends that I'm trying to show. But this slide shows the impact of the different recessions on our Transient revenue. But this is directly relatable to taxable retail sales, because we collect 0.5% of the sales tax that's on retail sales as part of the Transient program. And so the graph looks exactly the same. But the important thing to see here is what is the impact of some of these recessions. We called in our forecast a recession very early on, back at the end of March. We made the determination that this COVID crisis would probably push us into a recession. I don't know that nationally that has been confirmed, because we have to have 2 quarters of negative growth before they will officially call a recession. But I believe that we will have that and more during this time period. But if you take a look at the 91 recession, what we had there is something that I'm just going to refer to as a moderate recession. It took about 4 years for us to recover from that in terms of retail sales. And so if you think about the retailers in San Diego, or people, that's how long it took them to get back to where they were at. A mild recession like the 2001 recession, even though it was a little bit longer, we really didn't lose revenue. What ended up happening there is that the rate of growth actually decreased. And then you look at the Great Recession, and that's kind of a severe recession. And that took us 6.5 years to recover to the levels that we were at before the Great Recession. It took us 10 years to get back to the trend line. So when people say it took us 10 years to come out of the Great Recession, it's true, because we had to get back to where we were on trend. And so these concepts in terms of moderate, mild, and severe, I'm going to talk about on the next slide. That's why I just wanted to go over with you here. So this slide, and if you hit the button one more time, this is basically our pre-COVID-19 forecast. It was kind of a straight line, looking like we were going to increase in revenue. Can you hit it one more time? What I'm trying to show on this graph, this is something that I showed the board of directors, is just how volatile this situation is, and how the variables that we cannot determine impact greatly what's going to happen in the economy. So we're looking at 3 things. We're looking at the length, the shape, and the depth of any potential recession. So the length would be the length that it took of this disruption. Is it going to be 2 months, 3 months, 4 months before we get back to work? The shape of the recovery, you've heard a lot of talk about a V-shape recovery, a U-shape recovery, a long V, or the Nike swoosh. There's all sorts of names for it, but the recovery shape makes a big difference. And then the depth. Did we go into a mild, moderate, or severe recession, which I talked a little bit about on the last slide. So if we simply had a 2-month disruption in terms of our business, and we're able to just get right back to work without going into a recession, and this is what economists were talking about at the beginning, that we would basically be locked down for a couple of weeks, and then we just pop right back to the line. We'd lose $27 million in sales tax revenue. Again, you can gross that up and it gives you the number. But what I want to show here is the magnitude of difference as you make different assumptions in a model. So if you hit the button again, this shows what would happen if we had a 2-month disruption, we went into a moderate recession, and we came back out of it in a V-shaped recovery. If you hit it again, you'll see this is, would put us into, if we went into a severe recession, and it was a 3-month disruption, which is more like what we're starting to see now. We will not be out of this by May 15th, and we kind of started the lockdown in March, at March 15th, so it's already been 2 months. And it was a U-shaped recovery, meaning that we're not recovering as quickly. We could lose 10 times as much as we would have in the COVID only scenario. If you hit it again, just for comparison purposes, this is what it would look like if the recession that happens because of this crisis is like the Great Recession. That would be something like a 5-month lockdown. We would go into a severe recession, and you could see that it would take a long time to recover. In fact, it would be way past 2026, probably a 10-year recovery. We would lose over $500 million, so 20 times as much as the first scenario. And just in terms, one more click, please. The Great Depression, this is what it would look like. I think we're very far away from a scenario that looks like the Great Depression. And I think we're far away from a scenario that looks like the Great Recession. I think we're much closer to something that looks like the yellow line going to the red line. Next slide, please. So how does our forecast compare to other forecasts out there? This is the one that Sandag is budgeting to, which is a moderate recession, a 3-month disruption with a long V recovery. We're expecting about $80 million in losses at Sandag. If you hit the button one more time, this table just gives you an idea of what the major economic forecasting firms are giving you. So when using the same type of statistics. So what ends up happening, as you see, is there's kind of a consensus around 10, 12, 13% in terms of loss. The Congressional Budget Office and Deloitte are a little bit more pessimistic with their forecasts than we are. And then there are a lot that are a little bit more optimistic. But I think we're kind of in the range. So the numbers that I talk about are pretty much in alignment with what we see at a national level. Next slide, please. So who was really impacted in San Diego? That was a big question that we had to answer. And this particular COVID-19 pandemic did not hit every sector evenly, as you know. It was really based on those industries that were high touch, as people who were in the retail industry, the restaurant industry, the hotel motel workers, airlines, healthcare, those type of things, where you have to have close contact with people. So what does our economy in San Diego look like? We took a look at jobs and we broke them into categories of high contact, medium contact, and low contact. And there are roughly 337,000 jobs that are considered to be high contact. And as you can see in the bar chart, they fall into the categories shown there. And if you look at each one, you can see that each one has been hit pretty hard. The one that we thought was not going to get hit very hard was healthcare. Originally, we thought they were going to be pulling healthcare workers or doctors out of their last year of med school, putting them into hospitals even before they had graduated, and that didn't materialize. What ended up happening was that essential or non-essential procedures were canceled, and so we saw job loss in the healthcare sector. We also saw job loss in education, not as much because technologies like Zoom have enabled remote learning. I don't know that that's actually an effective tool long-term for kids. Transportation, high job loss, food and beverage, and personal care services, high job loss. What we see now, though, this is kind of the wave one of the job losses. We're starting to see wave two, and we're starting to see more people being let go, especially if you look at some of the bigger tech companies. You see companies like Uber and Airbnb letting go thousands of people. So this is now trickling into other areas within the economy. If you hit the slide again, this focuses a little bit more on what's happening in San Diego. These numbers come from the San Diego Workforce Partnership. And you can see that downtown was hit the hardest in terms of geographical location, in terms of the number of job losses. And it has to do with the concentration of tourism and retail really in those sectors. And so for the downtown partnership, I mean, I'm sure that you know that the downtown has been especially hard hit, and it's going to take a while for some of these businesses to really be able to come back. If you hit the next slide, this shows unemployment by place of residence on March 7th, 2020. So just 8 weeks ago or so. And what we saw is that regionally we had an unemployment rate of 3.4%, historical low unemployment. The entire region was doing very well. If you hit the one more time, this is what the map looks like on April 25th. We're looking at areas with unemployment rates as high as 37%, for instance, in Logan Heights. And you see areas all throughout the region being significantly impacted, even the downtown areas at about 26% in terms of the residents who live there who are unemployed. This is unprecedented, and this is truly something that nobody's ever seen, and I think that's an understatement. But what you can see from this map is that the areas that have the highest concentration of blue collar workers, the areas that have the highest concentration of Hispanic workers, those are the ones that have been hit hardest by this COVID-19 epidemic in terms of job loss. And it's because they are the ones who primarily work in those industries that got hit the hardest. Other areas like up around the 56 corridor, they've been hit hard too, but not as much because you have a higher proportion of white collar jobs there that can be done remotely. So office workers logging in and teleworking. So you see a little bit less job loss there. Next slide, please. This is the Downtown Employment Center as we defined it, and I think I showed this to your group just a few months ago. Within that area, we have had about 76,000 employees, and it was the third largest employment center in San Diego. And it's relatively well diversified in terms of types of businesses that are in there. But about 60% roughly work in the 5 industries that are listed on this slide. And I just kind of wanted to give some thoughts on what sectors are going to recover and which ones aren't. The tourism industry is going to have the hardest time recovering when you look at this from the highest level. My prediction is that it's going to be somewhere between 18 months and 2 years for the tourism industry to come back. And that has to do with the fact that until we figure out a way to travel safely, and that will require probably a vaccine, you're not going to see international travel and even domestic travel as much as you did coming into San Diego. So any business related to that is going to have a hard time getting back to where they were pre-COVID levels. So in downtown, about 16% of the employment is in the food services industry. That will be hit probably hard on more the high-end restaurants or the ones that cater to either businesses or they cater to tourists. Some of the more fast food places would probably do relatively well as they come back as downtown repopulates. But with that said too, many of those restaurants are small and social distancing is going to be a difficult thing if they can only have half as many tables as they did before they opened. I don't know how many of them can be profitable in a situation like that. So you will probably see a significant change in the downtown restaurant scene. When you take a look at local government, which represents 15% of the employment, probably most of that will come back. All local governments are having budget cutbacks, including us. We're reducing our workforce by 10%, but local government will come back to work probably in phase 3 with a long, telecommuting policy. So maybe a couple years before or a couple months before people start coming back. Accommodations, the hotels are going to be hit relatively hard. Again, because of tourism, Professional, scientific, and technical, those jobs should be able to come back as soon as it's safe to open. And that goes for healthcare and social assistance too. So hardest hit sectors within downtown are going to be those that are reliant on the tourism or tourism trade. Next slide, please. This just shows the consumer spend and what's happened week by week. And I just wanted to show you this because there's some interesting trends here. By 3/22, when the lockdown really was fully in place, you see apparel stores, department stores shutting. You see things like sporting goods stores shutting, and you see their sales plummeting. And that goes for things like car sales too, that's not on this list. Home furnishings also, but there are a couple bright spots. You've got Costco, for instance, and home improvement was doing very well. If you go to 4/19, you see that the numbers are starting to recover, and all of a sudden there's some that are actually doing better than they were doing pre-COVID. And this has to do most likely with the fact that some of the stimulus checks were distributed, and I believe people have more money to spend, and they're spending it on discretionary goods, and they're spending it in the places that are still open. So people want to feel normal. They want to go shopping. They want to buy a new blender just so that they can feel and do it. And so you can't go to the department stores or apparel stores, but you can go to Target because they've been open, because they have the food sales, and you see their sales increase significantly in the last couple of weeks. Same thing with home improvement. You've heard a lot of people putting in gardens and doing home improvement projects. Paint departments are really busy, so you see more spending there. On average, we're seeing spending being somewhere between 55 and 60% of what it was pre-COVID, and that is a very low level, but I expect that to come back as retailers can start to open their doors again tomorrow, hopefully, some of them. And then if you go to the last slide that I have here, as businesses reopen, there are some workplace considerations. I think Craig talked about, a lot of these very eloquently, but alternative work schedules are probably going to be more in line. So people who are non-exempt or they're on salary, they should be able to work flex time. They should be able to telecommute. So there's options for that. Physically rotating the staff is another one of those things that I think is being looked at, along with the enhanced sanitation. What we're doing at Sandag really is to continue to do the forecasting and the analysis. So we'll be monitoring this crisis as we come out of it. We'll be tracking data, things like consumer spending. We'll be looking at the unemployment rates, and we'll be providing data to interested parties and to our local governments to help with the recovery effort. And with that, that concludes my presentation.
Thank you so much, Ray, and thank you, Craig. There's so much information. You both gave wonderful presentations. A lot of what's opening is not quite clear yet. We might know more after the governor's press conference today. This recording will be living on the downtownsandiego.org website. So if people aren't catching things as we go, the recording will be there, and we'll try to give you some contacts for your specific questions about your businesses, either at the county or the city or where appropriate. So we're going to get right into questions now. The first question is for Craig, and it's from Richard. And in your opinion, what should be done to address the supply chain challenges related to obtaining appropriate cleaning and protective gear so that we can open safely?
That's a good question. So we have been working with the county and with the city on this. It's been communicated to the mayor. He understands it, and certainly Supervisor Cox understands it as well. We think that it's best for government to help us source and provide these types of PPE if they're required for certain types of employees. I think the key issue is what kind of requirements are going to come down today from the state. How is the county going to respond to that? And then how are we going to address those supply chain issues? Right now, we're seeing a huge delay in just basic non-medical grade PPE being delivered. In some cases, 60, 90, 120 days for hand sanitizer and hand sanitizer stations, which may be necessary in some buildings. So we're looking at alternative ways to try and protect the public health that are in keeping with what the public health officials are desirous of, but may not necessarily require the level of PPE or like a hand sanitizing station, just as one example, to be placed. If you have a restroom in your common area or in your business that has a sink, or if you have a dining area that has a sink, you can wash your hands. And if you don't have hand sanitizer, that should be compliant. So it's basically two parts, working with government to help us source them. They are better and more able to help us in that manner. And two, looking at alternative means to comply, basically for the public health, but that may not require some of that sourcing.
Great, thank you very much. This question's for Ray, and you're an economist, so you have your crystal ball. But what do you see in the next 6 months as far as unemployment rates or trends for recession in San Diego County? You touched on it a little bit.
Yeah, if you're taking a look at the next 6 months, I see the economy starting to reopen. There are a lot of businesses that just want to get back to work. And so you're going to see unemployment fall dramatically at the beginning of this recovery. Probably, as long as we don't, I'm going to caveat that with saying, as long as we don't, the numbers in the curve doesn't, start to go up again in terms of the deaths and the people who have coronavirus, which means that Governor Newsom would somehow, back off of who can open. But if we were opening on a normal schedule, like I believe we're doing, you're going to see this increase at first. And so probably most of the especially the office workers, when we get to that point, will go back to work. However, there's going to be a relatively long tail, because there will be some industries that are significantly impacted for the long term. So you'll see things like the biotech and healthcare and those things. They'll come back relatively well, as will insurance. Some of the real estate will come back relatively quickly. But when it comes to those tourism type businesses, the ones that are really reliant on the people who are coming to San Diego to spend money here at their establishments, that's going to have a much longer tail, probably 18 months to 2 years. So what I would anticipate is that we're going to see double-digit unemployment in the region in aggregate, probably through the end of the year. I don't believe that all of those hotels and motels will be able to hire back all of the employees that they had. In March, if you wanted a job, you could have a job. We were essentially at full employment. But a lot of those jobs won't be coming back. A restaurant operating at 50% capacity might be able to hire back 50 or 60% of their employees. They're not going to hire back the rest of them. So you're going to be looking at some significant unemployment in certain sectors. It's going to require probably retraining of some of the workforce, because until we have a vaccine developed and people are comfortable traveling again, and people are coming to San Diego for vacation and business purposes, those industries are not going to see the numbers that they had. Real quickly, I think that the summer vacation season is probably canceled for all intents and purposes, right? So you're not going to see people coming here for vacation. They have nothing to do. The zoo's closed, the SeaWorld, et cetera. And then when you move to the businesses, many of the conventions will not be coming to San Diego this year that we used to have. So that's why I'm thinking there's a pretty long hit and a long tail in that sector.
Great, thanks, Ray. Sobering news, but thank you nonetheless. Craig had a bunch of questions he answered already, and they were references to certification for businesses and that kind of thing. And I don't know if, Craig, you want to speak to that. We did put the county's website in the chat, but do you have an answer? Do they have to have certification as of today?
Yeah, I'm still trying to contemplate what Ray just said. I think that was a very truthful but unhappy answer. Thank you, Ray. As an economist, I know you do that. So the county is saying on their website that you have to fill out, print and post the form, as well as provide that form to all of your employees. It's not clear whether it needs to absolutely be submitted, but I will tell you that in the case of golf courses, which were allowed to reopen last week, they were asked to submit their reopening plans to the county, and there have been emails back and forth that I'm aware of to some of the operators where they were either indicated that they were acceptable or in some cases not acceptable. So it's unclear. I think what we'll learn today when the governor in just a few minutes starts his press conference is what the state will do, and then the county will adjust and work with those guidelines and then make a determination. But they're using the template that's on the website now as guidance for business owners, for employers to take a look at, those that might actually be allowed to reopen in this phase two, to give them some guidance on what they may be expected to do.
Great, thank you very much, Craig. Many people have asked about both of your slides, including Frank Busick and others. So if those are publicly available and you don't mind sharing them, we would share them in the chat and then on our website later today as well. I'm going to just get to one more question each because I know some of you need to get onto that governor's press conference and see what's happening at the state level. I think I'll just ask for your closing remarks, maybe a minute or two, and just overall, how are you feeling, or what do you want to say to us, the 260 of us on the phone or on the Zoom?
I would say that as bleak as it looks right now, that this too shall end. And when we look back at this a few years from now, this is going to be one of those disruptions like 9/11 that you remember for a long time, and we will have all lived through this. But the economy will eventually recover, and we will figure out a way to get back to where we were before. I honestly believe that. I think eventually, whether it's 6 months or a year from now, when a vaccine is developed, this goes away. So this is short term in the history books. It's really hard because we're living through it today.
Yeah, I've lived through a few of these now. Sad to say, I'm getting older. But I thought 9/11, never see anything like that again. It happened. We got through it. The Great Recession, thought, wow, that was, I can't believe that just happened. We lived through it. We made it. And now we're in the midst of this. I'm hoping that, I know we will get through it. I'm an optimist by nature, although I deal in the world of government where cynicism can kind of run rampant. But I'm just hoping that for the next issue, it's not any bigger or larger. I see this cascading thing. I don't know. But anyway, I think we'll get through it. I think our economy is pretty resilient, as Ray was saying. I know that people are eager to get back to it. And then once we get the vaccine, I think things will change dramatically going forward. But for the time being, it's about patience. It's about forbearance. It's about working together. It's really about communication. Whether you're a tenant of a building or an owner of a building or whatever, a business owner, it's about communication and working with people so that we can all get through it.
Thank you very much to both of our panelists today. Like Arissus mentioned, and Cantel, two of our members on the call today, there are some benefits for climate change and environmental, and we are still out there doing the important cleaning and enhanced maintenance of downtown San Diego. So I agree with the panelists that it's a really rough time for many of you on the call, but we're here for you. If there's resources we can provide you to, we'd love to do that. So on behalf of the Downtown San Diego Partnership, thank you to our panelists and thank you to all of our audience members today. And please feel free to reach out to us at any time. Stay safe, stay strong. Thank you.